I am a warrior, I am a fighter. I am a chronic illness survivor. I am my fellow warrior's admirer.
Inspiration for my blood sisters to thrive.
Scuffling with my body to stay alive.
Struggling for the ability to strive.
Conqueror a recurring death race.
Prospering in any case.
I am a warrior, I am a fighter. I am a sickle cell disease survivor. What's up, Cellies? Welcome back to our video. In this video, this is going to be another Confessions of a Warrior. Somebody did give me a suggestion too. Let me write it down.
How much? You remember that?
Yeah, they said aging with sickle cell. Somebody did give me a suggestion, so we're going to talk about that, but don't forget to keep giving us suggestions of what y'all want us to talk about, what y'all want to hear about, whatever, and we will try to get it done. But so in this video, this is going to be a Confessions of a Warrior, and we're going to talk about the way that we are treated when we were in pediatric care versus adult care with sickle cell. And I'm gonna just start off by saying when you was in pediatric care, like it was like Make-A-Wish Foundation all the time.
It legit was. It was.
It was like
pediatric is lit.
It was like they just treated you so well. Like you go to the emergency room, you ain't gotta wait. The doctor already done locked in with your hematologist. They know your care plan. They got you together. Whatever. And they let us stay there until we're 25.
Mm-hmm. Which was funny.
I stayed a little longer because I ended up, they told me that they needed to switch me over to an adult doctor. I went back to my pediatrician. Because at the sickle cell clinic, I had stopped going for like a couple of years. And I went back, I was going to the pediatrician. And when you go to the pediatrician, they give you solutions for your problems.
They be looking out.
And I'm not going to say they don't do that at the sickle cell clinic. They do, but I feel like because there's so much of us, I ain't saying there ain't a lot of kids, but I think because there's so much of us with sickle cell specifically, because pediatricians don't only have sickle cell patients, and they don't specialize in sickle cell, but they build close relationships with their patients, each patient, because they try to make the experience more personable. They are more compassionate, they're nicer, with you because you're a kid. And when you're a kid, you for the most part you get treated better than when you become an adult.
Man, look at
and we didn't go to sickle cell clinic. Well, we was in the sickle cell clinic since we were babies, but it was set up different. Like when we first were born with sickle cell, of course I was born first, 5 years before him. Is it 5 or 7? 5. It's 7 with Lonnie. 5 years before him. So we was going to Georgetown at first. Mm-hmm. We was going to it wasn't a sickle cell clinic, but it was a mini sickle cell clinic. If that makes sense. It was closer to us. It was closer to us than where we go now. And Dr. Jackson used to be there. Cause Dr. Jackson is like did she create it? She was the head of it?
I think so.
I think she was like the head of it, because I think that's who my mama talked to. That's who we have to sit down with our mamas too, because we don't know everything. Yeah. But Dr. Jackson, I think, was over it. So they kind of had it like broken off. Like they had the sickle cell clinic in Charleston, but then they had like these small clinics for smaller areas. And we live in a very small town that does not have a hospital. So even going to Georgetown, that's closer, but it's still like 30 minutes away from us.
Yeah, that's about 40.
That's that's who you ride with.
My mom that girl say who I ride with. If I'm driving,
which way y'all go?
We go that way.
Georgetown is like 30 minutes away from us. Maybe the clinic is a little further out, but the city is like 30
say,
minutes.
City, but
You get to the city in like 30 minutes,
Yeah,
but like
my
to
mom-
go different places, yeah, it's a little farther out.
My mom would be.
What?
Yeah,
She will.
she gonna be on the
Oh yeah, my mom would be getting it. Like we don't get it. Don't be taking us on 45 minutes.
No, bunny.
My mom would be.
Well, I'm about to say. Nah, me, I probably cut it down to like 15.
And used to take us, and then we used to ride together sometimes, and then
Yeah.
Mel used to drive us sometimes. And then,
Mhm.
well, he started driving when we started going to Georgetown too.
Yeah, he used to drive.
And then we
mainly
started going to
everywhere most of the
Charleston. But yeah, like when we was little, they had like these little smaller clinics broken up down, and then we used to go to whatever was closer, and for us it was Georgetown. I don't know how our parents got
Bro.
locked in with them, because like when I say we live in a small town,
Like, I was,
like I feel like we was talking about gentrification, and my mama was like, I said, oh, they finally about to
they
try to
is gentrifying.
They can't. You
Well,
cannot
they trying,
gentrify.
but-
You cannot gentrify a town like this.
They trying, but
Like you cannot.
it's
You
gonna-
you can go ahead and put your little coffee shop. Ain't nobody gonna buy that coffee.
that jump.
They
that jump
gonna
about to
keep
be
going
funny.
to McDonald's. You can bring
jump about to
whatever
be funny,
Whole
funny.
Foods. Ain't nobody buying it. They gonna keep going to them
Bro.
food stands on the side of the road. You cannot gentrify a town like this
You really
because
can't.
it's too close in it. The culture is too.
Bruh, it's
too
not gonna be
thick.
funny. 'Cause we
Like,
get
it just-
Taco Bell.
It can't happen. They still not gonna be
I
able
was
to do
like,
that.
yo, I was like, what can we get? A Taco
That
Bell?
ain't gentrification. That's
I know, I'm
hood.
just saying.
And look how it built.
It's,
The Taco Bell beside Pizza Hut is
That's-
always hooked on the Pizza Hut.
that's the first time I've ever seen
That's
that.
the hoodest thing ever. Like,
Yo, I always seen them hook on to KFCs. I've never seen them hook on to a Pizza Hut.
but you can't gentrify a town like this. You can't
Taco Hut
gentrify this
Pizza
town.
Yeah,
and
we
you
talking about
can't
Pizza Bell.
gentrify King Street. It just cannot happen. Like, go ahead and try,
I
but
said
it
it
ain't
took
gonna
us.
happen. You could bring your little coffee shops and your little smoothie stands. Ain't nobody
no.
buying that junk.
Hold on, nigga, you ain't getting none of that now.
Ain't nobody buying that.
Because first of all, you ain't gonna
People
make
gonna
nowhere
keep
near.
buying from the same people they been buying from.
They'll keep
You
going
can
to
bring
Kinko.
your little they little Whole Foods. They still gonna buy from the little stands on the side of the road. It's not happening.
Man, look, we
They
country
too we too loyal.
now.
So it's never gonna happen. But you can try. They can raise the rent and stuff. Guess what? People gonna move in with their family.
It sure is. They was
Like,
man,
you
bump
not-
that.
You not like all you gonna do is get people work. All you gonna do is bring the community together. Like it's gonna fail. It can't happen. But anyway, let's get back on point. But like we gotta make a video with our parents. But we was going there first, and will we go to Charleston every now and then or something like that?
Yeah.
Like we would go to the little clinic most of the time, and like we would go to Charleston for like certain stuff, like studies and stuff like that. So when did we start? When did we start going
Man, I
to
don't know. Ask your mama.
the Sickle Cell Clinic in Charleston? How old was I? I know I was young, but goddamn, she said young. I don't even
Lord.
remember. Like that joke just fused together so quick.
Wait, so what? Should I call my mom and check?
She ain't gonna remember neither. If she don't remember, you know your mama not gonna remember.
That's crazy.
But but when we was younger, it was easier, and like the doctors used to work together. Like you go to the emergency room, they don't really know a lot about sickle cell because, like I said, it's specialists and there's doctors.
Oh my
Doctors treat everybody.
They used to have to call our doctors.
Yeah, they would call our doctors and ask them for our care plans when we was younger. And why they don't still do that? We still go to the same hospitals.
I don't even know.
They don't even do
I
that
don't
no
even
more.
know. They will not call our doctors.
For nothing. And if they do, because I remember when I had a plastic crisis, and we gonna get there. But but when we were younger, like the doctors seemed like they used to work together. They worked together a lot. They would like I said, we go to the emergency room, they would call our doctors, ask for our care plan, then they would treat us like the doctors told them to treat us. We'd be cool. If we had to get admitted, it was cool. Like nurses even used to like actually work back then.
No,
I'm not saying they don't work now.
No,
it's like now you gotta do their job for them.
Essentially.
It's like, oh, we got this many patients. They always had a lot of patients. They always been busy, but they used to do their job. I didn't have to call them and be like, hey, it's time for my medicine when I was younger.
Oh, no,
but you got to do that as an adult. It's crazy. And then they be complaining. Y'all be expecting, yes, it's your job. What are you talking about? I don't get people these days when it comes to their jobs.
They do it for the pay.
What's the point of being in a job like that? You have to actually care about the people to do that.
Booty, they only want to pay. That's all they do it for.
It don't make sense to me.
They will go to school.
Then they want to be on the internet. Oh, y'all, it's not us. Y'all, it's so hard. We got so many patients. They always did. When I was little, they always had a lot of patients. And we were kids, and they was on it. They always was on it. We didn't have to. Nobody had to call them to remind them to come bring medicine, or y'all are supposed to change my linen today, or whatever. Like. And I got pretty privilege, and I still be struggling to get niggas to do stuff. I do. That's the thing in the hospitals. If you pretty, they do more for you without you asking.
That's all in the hospital. That woman's accent was so funny. That accent she had, that joke was hilarious. I called her in there just to laugh at her.
What woman?
It was my nerves.
And it do be certain nurses that be cool. Always,
yeah,
like even now,
the lit ones, they be
it's
cool.
certain ones that be cool, but it's certain ones that
like
be on their phone.
I was about to say, I remember when I was little, I had this nurse. This used to come in my room. They used to come in my room. He used to take me downstairs. We used to get candy and stuff.
Ooh, male nurses. Nurses used to be cool.
Like you know, little ramp when you go to the sickle cell clinic. This joker tell me, all right, bro, I'm gonna let you go, and I'm gonna let you hit the brakes.
I remember we used to have because we go to different emergency rooms. I go to Florence.
Yeah, I go to
Georgetown. Georgetown is too slow for me.
Yeah, they don't start doing that until that chunky angry woman start getting mad.
Like Florence is definitely better. They definitely are a lot better. They could be better. Like the last couple of times I went, they were trash. And I think it's because a lot of the times the good doctors don't stay there. Like you will find good doctors and good nurses, and they'll leave, and I hate that junk. And then you end up getting people that don't really care when they start becoming. I ain't gonna, you know what? I ain't even gonna throw the little titles out there. When they start they just different, but like. What that doctor name was? Dr. Russell.
Let me tell you.
In the emergency room was a great doctor. And there's a lot of them. And honestly, to me, from my experience, the emergency room is what is actually the problem.
The emergency room was horrible.
When you get admitted, it's better, but it could be better. But it's better than, like, going to the emergency room, that's a war zone before you have to even get treatment. You gotta go through that war zone.
Just from hearing stories from talking to a girl who worked in the emergency room was crazy. I was like, bro, they really do that in the emergency room? I was like, I'd go, but I didn't know.
They do a lot of like you'll be seeing people with sickle cell laying in the hallway, and the nurses are sitting down.
Yeah, she told me. She said the only people with sickle cell who gets priority is kids. If you ain't a kid, you ain't getting no priority. You gotta wait, and you might go behind. You going either go last or you go next to last.
Yeah.
I was like, bro, what?
They act like we're such an inconvenience. Like, oh my God, y'all are so hard to deal with. And I think a lot of it is because we know about our illness. Yeah. We're educated because we don't have a choice. We don't have a choice because y'all have to print out papers. Like, when you go to the emergency room, they have to go and look up information about sickle cell to figure out how to treat it. And you can't get that information off the internet or whatever they be going to because they be printing out papers. I be seeing doctors. I like doctors who come to me and be like, I don't really know a whole lot about sickle cell. What they do for you at the sickle cell clinic? And I tell them, and they do it.
I was about to say.
And I met maybe 1 or 2 doctors like that.
Yeah, that's how you can tell if it's a bad doctor. If they got an iPhone and an Apple Watch, they're a horrible doctor. And if they got them flops.
A lot of the times you don't even see them. You just see the nurses. Like, they'll just come in there and peek at you.
I look at their wrists. I look at their waist. I look at their pocket.
What's going on? I don't be paying attention to. I don't care. I don't be paying attention to them.
As soon as I look at all that and I see you got all that.
And like I said, there are some good nurses there, but it's not enough. It's like 1 to 10. Like 1 to 10.
It is a crazy ratio. It's a very crazy ratio.
And like I said, I got pretty privilege. So I know how good y'all can be. I know how good nurses can be. I know how y'all can treat people when y'all want to. So yeah. And I'm not bragging. It's actually weird to treat a person better because I don't even understand what people get out of it. I never got it. What is better? Like, why is it better? Why are you better towards somebody because they look pretty to you? Because you like how they look. What does that do for you? And like, it's not a sex. I even understand it better if it was sexual, but it don't be sexual. It just be, you so pretty.
I had this woman.
What you need? Like, you need this, you need that. You so pretty. Like what you need? It's like, okay.
Yo, the hospital is a very weird place.
It is,
and it's funny.
It is not funny.
Yeah,
I hate the hospital.
No, I hate staying there, but like
I hate that.
When I go for my trips, it'd be hilarious. I'd be like, bro, I had this woman try to give me. I
hate going because everybody be telling me their business.
Yo, people will talk to you. I hate that crowd. I'll be like, bro, I don't care about this.
I hate that job. Like, I don't like we live in South Carolina, so that's all people do. All they want to do is, I feel like, bruh, get this blood and shut up. God dang.
Like last time I went, I had the girl at the blood draw thing. Like, bro, why is you trying? Like, man, you see me, I'm up here half sleeping in this chair. Why are you trying to talk to me? I ain't say nothing to you. All I do is tell you my name and my date.
They be like, which arm? This be me.
I don't even do that. I just tell her, hey, man.
Your date, your birthday, your name, your birthday. I say that. I hold that arm out. You don't even got to ask me which arm. I'm sitting in that chair. I'm taking off my jacket.
I don't need to take off my jacket. They be like, where you want it at? My hand.
You don't even got to ask me. I'm trying to get up out of there. This is a 90-minute ride. I'm trying to go back home.
I'm like, bro, I'm here all day.
All of us do not live here.
Like, so where are you from? I'm from Saltus. Where is that?
I said Cane Screen. They still don't know what that is.
I don't know.
They be thinking that we from Charleston because we sound like them.
That's not funny.
And I'm like, and when you say Cane Street, and you know what? When you say King Street, they think you're saying King's Street.
Yeah.
Who lives there?
That's the ghetto, isn't it?
That is a business. It's like a business.
Oh, no,
exactly.
No,
it's like a business place.
No.
So why would you think that that's what I'm talking about?
I don't know, man. I guess it was King Street before.
No, it wasn't. It was always King Street.
Yo, the nigga's funny, man.
But we say both. We say them the same. We pronounce it the same because we talk like them.
We do talk like that. I know that
because we do talk alike. Cause we got love. But
well, what you want in your sub, man? I say
I love going to Charleston because
no, I had you laughing.
It's funny because like we all talk like this,
but we don't
hear it because we always around each other. But then when we go there, we hear it. Like, it's weird.
You look at me like, dang, you country. That thing was too funny.
And they think we country. Mm-hmm. It's funny. We're the same. We're probably related. You're probably my cousin.
I did tell you when I went to Burger King, they tried to give me a job. Thomas, you here for the job interview? No, I'm here for food.
Job interview? How you was dressed?
I had on boots.
Why you look like you? Why you look like you was going to it?
Booney, I had on a black shirt, some boots, and some pants.
You probably did look like you can't even work. You do look like you work. You look like all you do is work.
Oh No, but all the girls come from out the back. I think he here for the job in the young league. I'm looking like, what is y'all talking about? And they just in the back like. Then when I'm finally come to the counter, you here for the job in the young league.
You do like you work.
That's messed up, boy.
That's messed up. You do. I feel like everybody around here look like that.
We just say like I just work.
We just look like we just be working. That's all we do, work. Well, anyway, let's get back on the track. But yeah, like when we were younger, they treated us a lot better. Like it's so crazy, and it's like the cutoff line is so sharp. Like they give you up to 25.
I stayed there a little longer because I had to wait for space to open up at the adult clinic.
Yeah, ain't no such thing as an adult clinic.
It's sure
we just getting it.
That
was last year.
I legit had to sit there and wait.
I ain't waited.
I did. It was like,
and I wasn't
wait for spots to open up. I was waiting
because when it was like, there's an adult clinic. There was an adult hospital. They told me it was an adult hospital, and they didn't have spots. You gotta wait for a spot to open up. Guess what I did? Went right to the pediatrician. We haven't seen you for a while. I thought y'all was kicking me out. So I went to somebody that was gonna see me. Like, what you mean? I ain't about to stick around.
Nah, what is funny?
I ain't about to be in the way.
You extremely old, but you got sickle cell, and you still got to go to them pediatrician appointments, like X-rays and stuff. That woman tell me, she said, "Wait, you too old to be."
Yeah, you do.
Never got told that. They said they were never going to put you out unless you was ready to go.
Yeah, the pediatrician told me that.
That woman at the X-ray.
That's why I went back to them. They were talking like.
The woman at the X-ray front desk, she looked at me. She said,
and they would treat me like I was a little girl. How you doing, princess? I'm like.
I said, dang, woman. I was like, I know I'm too old to be here, but they tell me come here. She looked at me and really was like, you too old. You got to go around the corner.
They do be saying that. What is you talking about? There's no such thing. I'm in the right place.
I said, bro, both of y'all take pictures of what's inside my body. It don't make no difference what I'm
doing.
What
are you talking about?
You know how you go to the X-ray thing?
The first floor?
Yeah, and then it's the adult side of it, and you walk around the corner, and on the back side is the kids side.
No, I didn't know that.
Yeah, if you walk around the back, it's
that's dumb. It's literally the same people. It's so literally stupid. The same people drawing your blood. It makes no sense.
It's stupid, yo.
You too old.
I walk around that back. I was like, bruh.
The same place.
I was like, the only thing different.
You turn the corner.
Is y'all got dang Doro playing on here and the lights kind of dim in here.
It's right. Slow. But as an adult, as soon as you get that, you get 25, you feel that difference.
Yeah, you feel it quick too.
You feel that jump. But I was still going to the pediatricians. Like, for instance, when they was ordering me to get labs and stuff done, I was still going to the pediatricians. Mm-hmm. I was still going to Florence. I was still going over there. Well, not everything is MUSC now. It was Carolinas before. Not everything. MUSC taking over the whole freaking South Carolina.
MUSC trying to be like Disney.
The whole low country. They over there in Horry County too, ain't he?
Who's that?
Nigga, Georgetown. Follies Island, the beach and all that. What is wrong with you?
Oh, Horry County.
Bro, it's Horry County. We know about that. You know about to go back and forth about this name. Just because it's an H right there. Yes, no, it's not the Horry County.
Why would it be Horry?
We live in the South. We don't pronounce the H. What is wrong with you? It's just there for decoration. We don't pronounce it. It's Ori.
No, I don't think they got MUSC over there.
And
I don't think. So I ain't been there over a while though.
So it's the low country. That's the PD area.
Yeah.
So I think they take it over like the low country. So yeah. Hold up. Ain't Florence PD? I think it is.
Is it? What? Hold up. Let's Google that.
I think it is. But MUSC over there, it coming. It's just a little slow.
Mm-hmm.
But yeah, they've been taking over all of the little, like, the medical places in all of the small cities in the low country. So hopefully things improve. We just got a hospital that I'm never going to. I'm still not going. The Bob said they had like 20-something rooms there.
What? Oh no, PD is Clarendon, Chesterfield, Darlington, Dillon, Florence. Georgetown, Orly, Marion, Marlborough, or something.
Yeah, all of them is the PD.
Okay.
That's crazy because
wait, and Williamsburg counties?
No, we don't.
Say Williamsburg.
Including, it did say Williamsburg County. When did that happen?
Mm-hmm. I thought we was a low country too.
We still the low country. It's just the region. That's the region. But so I'm just saying I don't think that they're the low country. We are, but I don't think they are. But so yeah, they taking over. So hopefully things are gonna improve. I hope the doctors, because they were talking about this app or something that they were gonna start doing where they were gonna have our care plans and stuff like that on there. So when we go to the emergency rooms in different areas, and since it's MUSC, I shouldn't go to the emergency room and you give me 1 milligram of Dilaudid or whatever for my pain when you're literally in the same system.
Legit, you literally
like all my information right here. You know what they do when I go to the sickle cell clinic. You know, I need to start going to the sickle cell clinic more often. You know what? I don't be using my resources.
How much?
You don't do it either.
You talking about? I just been.
No, I'm talking about like when we get sick.
Oh, I sure don't.
Like when we have sickle cell crisis and they last for a long time, we don't call to go to the clinic to get treatment. It's a ride, that ride, bro.
If I could teleport, I would.
It do make you worse. It make you feel worse. So it's almost like let me just stay at home and suffer, because you gotta take that ride there. You gotta take the ride back. So you go there, you get treatment. It might help. But by the time you get back home,
I was about to say, we
that pain coming back.
I'll say if we lived in like Moncks Corner, it'll be worth it. It'll be worth the ride. But like,
it don't be worth it.
No, because we live like what, a couple, like what I say, what?
We live 90 minutes. We live 30 minutes away from Moncks Corner. Yeah.
Yeah, and then like Moncks Corner.
That's why I said I wanted, if I was gonna move, like
I'll move to Somerville.
I'm going to Atlanta. But if I was gonna move,
I'll move to Somerville.
I would go. Yeah, I would go back to that area, because then I would be able to do that.
Somerville legit right there.
Then I'll be able to do that, because like both of us was just sick. That's what take us so long. Well, we ain't missing no videos because I had them lined up. But both of us was sick, and I ain't even thought to do that. I used to do it sometimes. I just don't. And also, this sounds stupid, right? Because I got sick, so I'm in pain, right? So, and my pain meds wasn't working. And I had a severe crisis, and I was sick for a whole week. I got a little bit of back pain still. I'm still sore. My bones still sore. My ribs, all of that stuff. When I take a deep breath, I still feel the pressure and all that stuff. Because it went from chest pain to my ribs to my hip.
I had the same thing.
And my leg.
I told her all that crap. You know what she told me? She said, whenever you take medicine and stuff like that, that's mine. I ain't taking medicine. She said, whenever you take medicine or something, it do make your side hurt. And I was like,
yep.
I was like, I ain't take nothing else.
And you know what's crazy?
What that?
That stuff started from gas.
Yo, I didn't have that happen, yo.
Bro, that joke pissed me off so bad because I was constipated. I had gas. It wasn't even bad, though. My constipation wasn't bad. Usually it's bad. It wasn't. I had gas. I couldn't get it out.
Man, look at him.
It immediately turned into chest pain.
Yeah, that junk will happen
immediately.
That's
I was
why
like,
every time
I was at the computer trying to type, and I'm like, is this gas pain or is this a crisis? I was confused at first, and I'm like, it's just gas. I'm gonna just ride it out. No. Like, I literally was sitting at the computer like this, trying to figure out what was going on. Like, dang, is this chest pain? Like, am I really having chest pain because of gas? I couldn't believe it. It just pissed me off, and it went from that to my ribs, and it just like it kept going down. It's like it was moving with the gas.
Look at that gas.
And then I had pain in my hip, and for some reason this right hip has. I'm supposed to get another X-ray. I just got an X-ray. They give me an MRI already. Okay. I just got an X-ray. They told me to get another one. But I didn't go because, like I said, I was sick. I'm not going to get no X-ray while I'm in pain. Mm-hmm. It's hard enough. I was so uncomfortable. I was from my room. I came in here, tried to lay on the chair. Because, you know, when you have that like, I don't know if you ever had that type of hip pain where it feels like, literally like you on like a pulley or stretcher or something. And they just like pulling your body in opposite direction. This part, the leg in this direction, this part in that. Like, it just was severing it. And, like, I could feel the bone just, like, in the muscle, the tissue, everything just, like, pulling apart. That's how it felt.
Yeah, that's how my knee pains feel.
And it was so uncomfortable. Nothing that I did worked. It didn't work.
I'd be like, bro, I do not.
And I've been telling them that this is how my pain has been in this hip, and they telling me ain't nothing wrong with it.
They tell you got, what they told me? Unremarkable shoulders.
Like,
I was laughing when
I saw it. My left hip, I got bone infarcts.
Yeah.
But that right hip pain, way worse. And it don't even hurt as often, but when it do, bruh, that don't be taking me out. I'm like, I ain't even thought to be like, hey, I need to come in for treatment. I don't even be thinking about that, John, because like you said, that ride is long.
That joint's super long.
And I think that's it too. Like, living in the South, like, everything's so far, and we don't live in none of those cities, and it's expensive to live in those cities. We ain't got it like that. They should have programs so we could move to them, so we can have the access, because that ride alone, like, it's kind of like it's pointless, because I go there, I get the treatment, maybe the treatment work, maybe it don't. Come back home, and then the pain done aggravated again because I had to take the ride back here. And riding in the car is not comfortable at all. Like, it's not. But yeah, both of us were sick. But when you get treated as an adult, like I said, now that they've been combining the medical centers, I'm hoping that it gets better. I doubt it. I'm hoping that it gets better. The emergency room, they need to just rework their whole system. And they need to have a system set specifically for sickle cell patients. Why is that not a thing? And I know that they got access to that information, because all they gotta do is MUSC. Like, y'all already MUSC. Why y'all don't got that? They say they got an app. I ain't see it yet.
They got an app.
I was told that they got an app.
I didn't even know they had an app.
Where they are putting our care plan. So when we go to hospitals that are not them, they'll have what to do when we're in certain situations.
Oh.
But they were working on it. They didn't say it was out yet. But I haven't heard about it in a while, so I don't know.
Yeah.
I mean, my chart. That's all you
I
need.
was about to say, like,
that's all you need.
Why don't just use that? Because I think it's other hospitals use my chart too.
Yeah.
Like, that's literally all y'all need.
They get our information all the time. They ask us to sign papers, so they'll be able to get our information.
I'm about to say, it's all right there. All you do is log in all my charts.
Right.
You see everything.
But yeah, when we was kids, like I said, it was like Make-A-Wish Foundation all the time. When you go to the hospital, they got your snacks, they got your IV ready, you got your oxygen ready. Now you go as an adult, you gotta ask for the oxygen.
You ask for everything.
You gotta ask for certain things. And when I go to the emergency room, I'm not going for pain medicine specifically. I'm going for the combination of my IV, the pain meds, and the oxygen. Because that's what I need to get better faster. The pain meds by themselves are not working. At this point, I might as well build my own hospital. So I won't have to go ever. But the way that we get treated is definitely completely different. And like soon as you get to that age, you feel that junk. Ain't no like, there's no like.
They don't ease you into it.
They don't ease you into it at all. It's 1 minute you good. The next minute.
Mm-hmm.
Well, we can only give you 1 milligram of Dilaudid and can't give you. Well, in Florence, they don't necessarily keep the Benadryl, the IV Benadryl from you. I don't know why they do that anyway. I've never experienced them not giving it to me. So a lot of people with sickle cell, they be having to fight for that junk.
Wow.
It's crazy. I've never experienced that, no. But they do be trying to be skimpy with the medicine. And it's like, I take 8 milligrams at home. What is one going to do? Like, what is one going to do? I could have just stayed home. Give me this IV and give me this oxygen and let me go home. That's all I'm here for. Like, it be stupid, bruh. I'm really gonna get me one. You think I'm playing? Like, I saw somebody did a video about the essentials that when you go flying, what you take. She had like a pulse thing, an oxygen where you can check your oxygen or whatever. She had a portable oxygen tank, like a little compact one. And I was asking Dr. Martin, like, you know what? Like, I see some on Amazon. Let me know which one I need to get. Because I'm getting me one of them junk. It seemed like that's what we got to do. Because, like I said, when I go to the emergency room, it's not for pain medicine. But they treat us like that's what we going for. I go for the combination of all of those things because pain medicine is not... Only pain medicine is not working. That's why I'm here. If I wanted pain medicine, I could just stay home and take my medicine. But it's not working. I need the IV. I need the oxygen. You have to ask for it. And then every time I go, it's this doctor who be yelling at his nurses because they didn't give me the oxygen. Don't ever let them not. I'm like, bruh, why do we have to go through this every time? I know I don't come here all the time. I know it be years. But why do I have to say, hey, can you give me some oxygen? And then when you do that, they look at you like why are you asking for that? Like, are you dumb?
Like, bro, I'm over there struggling to breathe. Get me up.
It ain't even struggling to breathe. That's protocol for us.
I guess they don't know.
Because sickle cell, it's the absence of oxygen in our blood. So the oxygen helps in the process of treating the crisis.
Yeah, they don't know that.
That's my point.
Be,
that's the basics. Why don't you know that? You knew that when I was 25. You knew that. When I was 24, you knew that. Now I'm 26 and you don't know. You just forgot. How? Like, that's my point. How? Is it like these niggas just wait until we get a certain age and be like, bro, I can't wait till they get 26 because I ain't giving them nothing. Like, that's what I mean. It don't make sense. How is it that we get this type of care when we're kids and up until we're 25 years old, and they may be a different age in other states, but over here it's 25, and then when we turn 25, now y'all don't know that we supposed to get oxygen when we in a crisis. Now y'all don't know, but y'all knew last year. That is stupid. It's crazy. And that's the problem. it's like, oh, they an adult now, throw their care plan away. Anyway, even though we was all over the place, I was trying to go in the order, but whatever, y'all get it. Thank y'all for watching this video. Like I said, if y'all got any other topics that y'all want us to address, let us know and we will try our best to do it. We will see y'all on our next video. Bye. Before you go, check out our website at cellmatesapparel.com so you can learn more about us and so you can have access to our online Teespring store.